Okay, fetal circulation. Okay, not too bad. And I'll show you a website you can go to help you along with this. All right, fetal circulation. Why are we making a big stinker about this? Remember when we were about 2 years old and mommy was pregnant and you didn't understand what's going on, and mommy says, that's the baby in there. And then you're thinking at 2 years old, oh, that's the baby. Do you love it? I love it. Then why did you eat it? Right? I mean, that's what it's in a kid's innocent mind, right? So then mommy's going to explain, oh, no, this is where daddy and I, we love each other, and, you know, as a blessing, we get this, a baby that grows in there, and just end it right there for a 2-year-old, right? How babies are born, right? But then he or she's going to have a few other questions. Okay, now he's going to start thinking like some logical person. All right, if the baby's in there, now get this straight now. If the baby's in there, how is the baby breathing? There's no mouth that could go out and breathe the air. And then if that's so, then how is the baby eating? And this is where we're going to get into the fetal circulation to answer these two questions. Okay? We have to create a different pathway for the blood so that the baby, because remember, these organs are still growing. The liver's still growing, the lungs are still growing, so they're not going to function. So we have to have another way to get the nutrients to the baby, another way to get the oxygen to the baby, and for to get the carbon dioxide off the baby. Does that make sense? Okay? So we got to find a different way to do this. So this is why the pathway is different. The baby's fetus, the fetal liver is still growing, so it's not going to function. The fetal lungs are still growing, so they're not going to function. So we're going to get nutrients from mom, so it already has gone through mom's liver. All the toxics are gone, all the nutrients are broken down to the simplest forms. So now this is, we could bypass the whole liver in the fetus, because we don't need to go there. It also is blood that came from mom's lungs. So now blood is going into the baby, it's already oxygenated and it's already detoxified. So it has to bypass the fetal lungs and the fetal liver. And that's why we have this separate system here. Okay? So the blood entered the fetus is from mom. Blood has already been through mom's lungs. So this blood that's going to the baby is oxygenated, and it's already been through mom's liver, so therefore all the nutrients have been detoxified and broken down to the simplest forms, so now it's going into the baby. So therefore the fetal blood must bypass the fetal liver and the fetal lungs. So we've got to create a system to do that. Now I don't want to lie to you and say there's no blood going to the liver, there's no blood going to the lungs. Very little. It's tissue that's growing, so it's going to give it nutrients and oxygen, but it's not going to go to the liver and lungs because of the function of the liver and lungs. They're just going there so that these organs can grow bigger. Does that make sense? It's tissue that needs to grow. Okay, so it's useless to be going there because it's not functioning. It's under construction, if you want to put it that way. Okay, so here's the fetal circulation and its changes. And we talked about a few when we dealt with the heart. The umbilical vein. The umbilical vein is coming from the placenta. The placenta is the baby's lungs, because this is a place of gas exchange. Oxygenated blood is coming from the placenta. In us, it comes from the lungs. So the lungs is analogous with, the placenta is analogous with the fetal lungs. Does that make sense? Okay? So we need to find a system that's going to bypass the liver. So the umbilical vein, and this is a vein that's carrying oxygenated blood. Very rare that we see something like that. Where else have we seen a vein carrying oxygenated blood? The pulmonary vein. So this is our other exception. So we have one umbilical vein that's going to come from the placenta and going into the baby through the belly button, okay? And then it's going to go up towards the fetal heart, but it has to bypass the liver. So there's this little bypass or bridge called the ductus venosus, and it meets up with the fetal portal vein. And we're going to bypass the liver, and I'll show you a picture of that. That goes right into the inferior vena cava, which goes to the right atrium. All right? So blood doesn't need to go to the liver because it's already been through mom's liver. There's no purpose to go into the fetal liver. So this is what's happening here. Let me orient you. Here's the placenta over here. This is the umbilical cord that contains the umbilical vein and 2 umbilical arteries, which we'll get into. Here's the kid's belly button, and now inside the baby itself. Okay? We're going to have an umbilical vein continue upwards here, and here's the hepatic portal vein coming from the gut, or the intestines. Once the umbilical vein and the hepatic portal vein converge, it now becomes the ductus venosus. It's going to be near the liver, but it's not going to go through the liver to have blood leave that area to go to the liver. This ductus venosus then goes into the inferior vena cava. The inferior vena cava is then going into, as you all know, the right atrium. But now, the right atrium is carrying a lot of blood pressure because it's coming from the placenta and all oxygenated blood. Right? Does that make sense? It's kind of a weird thing. That's why you have to understand it. Okay? Now, we have a ton of blood entering the right atrium. All right? So this is our heart. All right? Right atrium, right ventricle, left atrium, left ventricle. So we are going to have tons of oxygenated blood over here. But we got to get it onto the other side because we have to bypass the lungs. As you know, through regular blood circulation, blood goes from the right atrium in an adult to the right ventricle to the lungs. We don't like that in the fetus. How much blood normally would go into the left atrium in a fetus? How much blood would enter the left atrium? Very little, because we're bypassing the lungs. The blood from the lungs would normally in an adult go to the left atrium, but that's not what's happening. So what's going to happen is that we have that little valve that's happening over here. This is called the foramen ovale. Okay? So in the fetal heart, a lot of blood is entering the right atrium. The right atrial pressure is greater than the left atrial pressure, and a valve is going to open. This valve is called the foramen ovale. There's very little blood entering the right or the left atrium normally from the fetus. So now this valve opens, and most of the blood will go into the left atrium by way of the foramen ovale. Foramen meaning whole, ovale meaning oval. But we still have a little bit of blood entering the right ventricle, just the way it would happen. So there's going to be, what's the valve over here? Yeah, tricuspid. So there's going to be, not much, there's going to be some blood entering the right ventricle. Most of it's going into the left atrium. Goes to the left atrium, the left ventricle, to the aorta. Now you got oxygenated blood going to the aorta, which is where you want it to go. But we have this other issue here. The little bit of blood that's going into the right ventricle. But we have another bypass, where the pulmonary trunk is to the aorta. I'll show you that in a moment. So a little bit of blood that goes here is going to go from the right atrium to the right ventricle to the pulmonary trunk, and then there's a bypass going from the pulmonary trunk and connects to the aorta. So all the blood, oxygenated blood that's going this way goes into the aorta. All the oxygenated blood that's going this way is still going into the aorta because you have that other bypass. So again, we have to do this to bypass the lungs. There is very little blood going to the lungs because it's tissue. You don't want it to die. It's still growing. It's not going to the lungs for function. Gas exchange, right? So, what's going on here? Blood is entering the right atrium. Most of it is going to go through the foraminal valley to the left atrium. Goes into the the left ventricle to the aorta. Perfect. Little bit of blood will go from the right atrium to the right ventricle into the pulmonary trunk, but then there's a bypass. A little bit of blood's going to the lungs just to give it nutrients, but there's a bypass going from the pulmonary trunk to the aorta. That's called the Ductus arteriosus. And this way, we're getting all the oxygenated blood into the aorta. Is that clear? Okay. All right, now, everything else is pretty much the same, going to all the arms and legs and abdomen and stuff. But now we've got to carry deoxygenated blood out of the fetus. We don't have the lungs anymore. So what happens here is from the aorta, it goes all to the fetal tissue, arms, legs, abdomen, whatever. Then it goes to the common iliac, and now we got a branch from the internal iliac going to what we call the umbilical arteries. The umbilical arteries are going to carry deoxygenated blood, and it's going to go out of the baby's body from where the belly button is. Two of these umbilical arteries will wrap around the umbilical vein to the placenta. And that's what's going to do the gas exchange. So carbon dioxide comes off of the placenta that way. Okay? So we have two umbilical arteries and one umbilical vein. I could have came up with this thing here. If we do a cross-section of the umbilical cord, you will have wonderful blue eyes, the A's over here, because there's two arteries, and they're carrying deoxygenated blood. And then the mouth is one vein, and it's carrying oxygenated blood. So you have a three-vessel cord there. Okay? So, let me show you what's going on again. There's the aorta, all that'll be about the same. Then it goes into the common iliac, to the internal iliacs, and then you got two branches coming off the internal iliacs that lead towards the belly button, wrap around the umbilical vein, and go back to the placenta where it's going to release the carbon dioxide. Sound good? A lot there, but this is the time to do it for this practical exam of the heart and the blood vessels. It's all dealing with the same thing. Okay? So what you have here, this is looking inside of a baby. There's the liver over here. Here you have the umbilical vein going towards the liver, and you have two umbilical arteries that go towards the urinary bladder in that area there, which is really not the urinary bladder, but it goes to the common or the internal iliacs. Okay? Now, we only did half of it because it can't stay that way. So when we cut the umbilical cord on a baby, we're going to see some changes. Okay? You know why you tie an umbilical cord on a baby when a baby's born. You understand that? You have to do that, otherwise the baby will fly all over the place. You guys are all right, I tried. All right, but you tie the umbilical cord, okay? And you don't really tie it, you clamp it down, all right? I never understood what they mean by taking a baby and flopping it and making a bow tie. You clamp it, and then you cut in the middle. Okay, so we need to talk about the changes. What happens to these things? Because there's no more placenta. So think what's happening here. Baby comes out. We're going to cut off the blood supply from the placenta. So now there isn't much blood going into the baby. But what happens to the baby when a baby comes out? What is the first thing you want to hear? And those lungs fill up with oxygen, fill up with air. And now the blood is going to rush to the lungs to see all that oxygen over there. So what's happening here is this. This is the fetus. But once we cut the umbilical cord on a baby, what happens here is that we're going to have very little blood entering the right atrium, and now we got so much blood from the lungs that is going to enter the left atrium. And what happens here with this foraminal valley, it's going to close. So the closure of the foraminal valley makes it so that there's a little indentation over there, or a fossa. We now call it the fossa ovalis. And like I said, when it was open, it was called the foraminal valley. Now it's a fossa ovalis in the adult. Don't make a hybrid. Don't call it the foraminal ovalis. It would be totally wrong, because I don't know which one you mean. Don't call it the fossa ovale. I don't know what that one is. Not being hard, I just don't know which one you mean. Okay? So that's what happens here. We also have the closure of the Ductus arteriosus, that bridge between the pulmonary trunk and the aorta. And that becomes a ligament. Not a ligament that would connect a bone to a bone, but it kind of gets, no blood flow goes through there, so it collapses on itself and becomes obliterated. Okay? But it shows that there's a remnant there, and it's called the ligamentum arteriosum. The only other place I've heard of ligamentum arteriosum is the first Harry Potter movie, where I guess changes the person into a frog, ligamentum arteriosum. Okay, you guys are dead. All right, so I want to show you on these two models here. You saw the fossa ovalis I showed you from before when we did the heart. Well, I'm not going to show you that. But what I do want to show you is the ligamentum arteriosum. Harry Potter, okay? And you can see it's white on this model here, and it's brown on this model over here. See that little bridge between the two? Let me show it here. Okay. So the white over here, it's bridging the pulmonary trunk with the aorta, and the brown on the other model. And hint, this could be on your practical exam. Okay? It might ask you, what was this in the fetus? It also might ask you, what was this in the fetus? What was this? What type of blood was it carrying? Okay, you should understand those. The white thing? Mm-hmm. Right? So this is the ligamentum arteriosum, not the ductus arteriosus, because this is, just do it again. Okay. This is not a fetal heart, it's an adult heart. Okay? Questions on that so far? The closure of the umbilical vein is called the round ligament of the liver. Okay? There is a round ligament when we deal with the female reproductive system, so you do have to mention round ligament of the liver. Or it's also known as the ligamentum teres. So either one is totally fine. Okay? The closure of the ductus venosus becomes the venous ligament, also known as the ligamentum venosum. Either one is fine. Okay? And the umbilical arteries, they get obliterated and collapse too, and they become the umbilical ligaments. Again, these aren't ligaments like bone to bone, that just gets collapsed and there's no blood that goes through it. It gets obliterated like that way. Okay? So, this chart is really neat because here it's showing you the feature, let's say the foraminal valley. It tells you where it's located in the interatrial septum. Before birth, what does it do? After birth, what does it do? So it gives you an idea of what's going on. Again, it's more active if you just put in feature location before birth, after birth, and just put these things here and then leave that blank and you fill in this stuff. That's active learning. After you make it and just put it on your fireplace mantle, I don't get much out of it. I just stare at it, but there's no assessment to see if I know the material or not. Okay? So it's up to you. If you work good with charts, super. If you don't, then use it for whatever works for you. All right. This looks like we just went over, but it's different. This is the postnatal circulation. Notice that there's no umbilical cord here, there's no placenta. Here's the kid's belly button. Okay, so this is after birth when you cut the umbilical cord. The umbilical vein becomes the round ligament. The ductus venosus becomes the venous ligament. And now blood supply can go to the liver, the hepatic portal system, as it normally would. The foramen ovale becomes the fossa ovalis. The ductus arteriosus is going to become the ligamentum arteriosum. And then over here, you got the umbilical arteries becoming the umbilical ligaments. Okay? So there's the before and after. Questions about that? Okay? So, just want to show you a few things how to apply this. We already dealt with a couple things, but since you're in my class, you know what I do. What happens when things go wrong? And that's the way you got to think about it. All right? I know in the nursing program, I talked to them, and they would ask me, this happened about 2 years ago, they said, didn't you go over this stuff? I'm like, are the students over there insulting me? Because I know I go over it. You have to do it, because they're like saying, do we have to go over this again with the students? I said, no, we went over it in A&P too. You don't have to go over it again. The students know it. At least my students know it. Okay? So you're going to need to know this, at least with nursing. I'm sure with other things too. So what if things go wrong? What if the changes don't occur? Okay? We talked about this, a00 septal defect. If this doesn't close properly, you're going to have blood deoxygenated and oxygenated mix. Not good. That's called an ASD, an atrial septal defect. We have to fix that. Okay? And if it's small enough, they literally will put a plug in there. If it's big, then we got to do a lot of surgery, and we're going to, well, not that that's not surgery, but we got to do a lot of suturing and stuff. Okay? We also have a defect, or it can happen, in the interventricular septum. And the way this develops, as I showed you before, we have two buds that go like this, and it kind of goes up and like this until they close. If they don't close, then you're going to have a mixture of blood, deoxygenated and oxygenated blood. Not good. This is more common. A VSD is more common than an ASD. Okay? And the last one I want to really do with you is this, and this is really putting this all together. If you don't know how to do this, it's because you don't know the fetal circulation. So these little things over here help you to make sure or assess that you know fetal circulation. It's something called a patent ductus arteriosus. Patent means that it's left open. Okay? It's also known as a PDA. So this is what happens over here. The ductus arteriosus remains open after delivery. Not good. Okay? That's the connection. The ductus arteriosus, again, is where the pulmonary trunk bridges or enters into the aorta. And this happens in certain cases. So look what's going to happen here. I'll go step by step for you. In the adult or a child, so everything, there's no placenta, we're going to have blood entering, deoxygenated blood entering the right ventricle. Does that make sense? In the child or adult, not in the fetus. Okay? The deoxygenated blood is then going to go into the pulmonary trunk. That's normal, right? But now you have a bypass that's still there, a patent ductus arteriosus that connects the pulmonary trunk with the aorta. So blood can go this way. But how much pressure is in the right ventricle compared to the left ventricle? Very little. So let's look at the other side. There's a connection there. There's no valve there, so blood can go either way. The left ventricle is going to push blood into, so the oxygenated blood, it's going to push blood from the left ventricle into the aorta. Does that make sense? Should. But now, as it goes into the aortic arch, blood will go into the three branches of the aortic arch, but now you have another way that it actually can go. It's through this patent ductus arteriosus. So now blood is going to enter here, and where does that go? Into the lungs. Does that make sense? Look at the way the pathway is. Now the lungs are getting more blood than what it should with great pressure. Can you visualize that? Because the pulmonary trunk leads to the pulmonary arteries. The ductus arteriosus, going backwards, leads to the pulmonary arteries, which go to the lungs. So the lungs are going to fill up with extra blood, which means there's more blood going to the left ventricle. Not? Do you see it? Do you see a compound happening here? So now you're going to have more blood, and disregard this, this is all closed. You're going to have more blood than usual entering the left atrium, which means you're going to have more blood entering the left ventricle. This is closed. Do you understand what's going on? So now the left ventricle has to pump more blood out of it. And if you start, like Arnold Schwarzenegger, if you start picking up, let's say, 10 pounds, and now you're going to start picking up 100 pounds, what's going to happen to your muscle here? It gets bigger. So what's going to happen here is that the left ventricle is going to get thicker. Not only this way, all right, but also this way. Which means that this cavity is going to get smaller. Because the muscle's getting bigger. Does that make sense? Now, you can't pump all that blood from here, or you can, but it's not going to be able to take in all that blood. You're going to have pulmonary congestion because there's so much blood that can only get into the left ventricle. So now the cardiac output is going to drop. All right? So, here's where it is in order. If you follow me on this, there's the PDA, the patent ductus arteriosus. There'll be a backup of blood to the lungs. Follow the arrows. There's going to be an increase of blood to the left heart, which means there's going to be an extra effort of the left heart, pumping harder. You're going to have what we call left ventricular hypertrophy. The left ventricle wall is going to hypertrophy. It's going to get thicker, bigger, which means that you're going to have a decrease in the left ventricular cavity, which means you're going to have a decrease in cardiac output. Does it make sense? It wouldn't make sense if you don't know the fetal circulation. Okay? Questions on that? Okay? This one you could do on your own. I won't ask you any questions about it. It's called tetralogy of Fallow. All right? It has 4 different things going on with it, 4 different defects, kind of stuff we already talked about in the past. I won't ask you about it. They will ask you in future courses. I guarantee it. But if you really have a knack of, like, I wish I knew more stuff about this, and I do have students that do that, then go for this one. It's a little bit more complicated, but if you go step by step, you'll understand it. Okay?